Good morning, everyone. I'm Dr. Elena Poulos from Kingsway Dermatology. Today I'm going to talk about melasma. Melasma is quite a common condition, which is very tricky, can be super difficult to treat. But with the right approach, with a cautious approach, it can be very manageable. So let's dive right in. Let's start first with talking about what is melasma. So melasma is a condition which causes hyperpigmentation of the skin. That means there's areas on the skin of the face where the skin becomes darker in patches. Often seen as patches on the cheeks. It can affect the upper lip as a common area, sometimes around the temples and the forehead. It most often affects women, although we do see it in men as well. I would say the ratio is about 85% women to 15% men. It usually occurs in people that have had a history of excessive sun exposure. Often the sun exposure happens when they're young, like in their early years, in their teens and 20s. But this patchy hyperpigmentation often first is seen later on in life. We used to commonly see it in people in their 40s and 50s, but I feel nowadays we're seeing it even as early as people in their 20s. It's more commonly seen in people with darker skin tones. Some of the triggers will include hormonal states, like people that are on a birth control pill. Pregnancy is a common trigger, and it's often called the mask of pregnancy. There are certain medications as well that can cause it. So how is melasma diagnosed? Typically, melasma is what we call a clinical diagnosis. So rarely we do biopsies. The odd time we can do a biopsy only if something is very complex or not responding to treatment, but typically it's really just on visual examination. The way we diagnose melasma compared to other causes of hyperpigmentation is usually the characteristic of the pigment. So often it's quite well demarcated, meaning the outline is quite sharp and it's very patchy. Other types of hyperpigmentation, like post-inflammatory hyperpigmentation, for example, tends to be a lot more uniform or even, or the edges tend to fade quite a bit more. As well, we can diagnose melasma based on its characteristic distribution. So often around the upper cheekbones, the upper lip, and often around the temples and lateral forehead. Sometimes to make the diagnosis of melasma, we can also use a Wood's light to help. A Wood's light is a special type of light that emits UV light at a special wavelength. When we look at skin with this particular Wood's light, pigment which is on the surface tends to be very well demarcated, whereas pigment which is deposited deeper down tends to be quite faded out and ill-defined. This sometimes helps us guide judgment to know which strategies are going to help lift that pigment. So let's dive into treatment options for melasma. Melasma can be a very tricky condition to treat, and a cautious approach and a thoughtful approach is absolutely paramount in success. First step in melasma treatment is really to prevent it from getting worse. So this is really all about sun protection. We recommend mineral sunscreen over chemical filters for a few reasons. Mineral sunscreens really block UV light over a broader distribution of UV wavelengths. As well, we recommend that sunscreen that's used for melasma also contains pigment or color. That's iron oxide that's added into the sunscreens. The reason iron oxide is important for melasma is that we do know that light, even in the visible spectrum, can trigger melasma. If you're using strictly a chemical-based sunscreen, the visible light will go through that sunscreen and can trigger and make your melasma worse. Other factors that are super important, of course, is to block the amount of light hitting your face. So wearing your hat on a regular basis is very, very important. Other considerations, which might be a lesser importance but still there, is with your sunglasses. We kind of recommend staying away from the mirrored sunglasses because light coming down can hit that mirror on your sunglasses and reflect black on the upper cheeks, which is a really common area for melasma and can make the pigment quite a bit darker. Finally, remember that if you're really out in extreme sun, like you're vacationing or you're on the dock somewhere, make sure you're reapplying every 2 hours. Also, if you're a water person and you're swimming or you're enjoying water sports, really go for a waterproof or water-resistant sunscreen. We know that there's really no such thing as a fully waterproof sunscreen, but some of them tend to stick on and last a lot longer than others. They tend to be more sweat-proof. Again, usually the ones in the mineral sunscreen category tend to have more of a lasting power. So some types of sunscreens to try. There's a few that will work very, very well for you. One of my favorites is the Tizo brand. It's a mineral-based sunscreen, and I do find it to be really quite waterproof. Sajic is a sunscreen as well, which is predominantly mineral-based, has a tint to it, very waterproof. This one here is an all-Canadian product for somebody looking to support Canada. And Elta, which has also been around for many years, comes with a mineral-based tint, also a very popular product. Okay, so how do we treat melasma? We talked a little bit about the first priority, which is really don't make it worse. And that's really all about sun protection. Step 2 becomes all about now how do we lift the pigment and remove the pigment which is already existing? And there are several lines that we can look at, several lines of attack. The first line is thinking about topical treatment. So that really means creams. And we have creams that are prescription and creams that are over the counter. Let's first dive into the prescription creams. One of the classics that's been around for years is what we call the Kligman formulation. And this was named after the person who first developed it probably 50 years ago. This is a combination of hydroquinone, a little bit of cortisone, as well as tretinoin. So these creams are typically compounded at the pharmacy. Sometimes we add other ingredients to this mix to help lighten and lift the pigment. Hydroquinone has been around for years and years, and we still consider it the gold standard as far as topical ways or creams that can lighten pigment. We know that the way hydroquinone works is it blocks the ability of the melanocyte to produce pigment. So that's really the mechanism of action. Typically, hydroquinone is compounded in these creams from 4% up to 8%, and it really is quite effective. There are some limitations with hydroquinone. Firstly, we recommend that use of hydroquinone is limited to 3 months at a time. There is a complication that's seen with long-term use of hydroquinone called ochronosis. This is where patients can develop a grayish blue dark pigment in the skin. Those deposits are very, very deep and are very difficult to clear. Fortunately, we don't see very much of that in Canada because most dermatologists and qualified providers are aware of this complication and advise patients to be very cautious with the use of their hydroquinone. Another limitation with hydroquinone is it really must be used only on the areas that are hyperpigmented. So it will also lighten unaffected skin. In other words, it can bleach or lighten the look. So if patients are applying this all over their face, yes, they're going to get lightening of their dark patches, but the normal skin is also going to lighten as well. So in the end, you're not really getting a cosmetic win out of that. There's other ingredients that can help as well that are applied topically, such as kojic acid, niacinamide. There's vitamin C that can be used. There's glycolic acid. These all work with different mechanisms of action. So some of them work in an anti-inflammatory capacity. So we know inflammation drives pigment. Others are involved at the level of the melanocyte and they block pigment formation. So the addition of these individual ingredients in the Kligman mix can be quite helpful. Often on their own, the progress can be slow. So if they're used without hydroquinone, although yes, we do see improvement over time, it can take quite a long time, and I find patients sometimes feel a little bit frustrated with the progress. Let's talk about oral medication for the treatment of melasma. Tranexamic acid is a medication that can be used. The dose is typically 250 milligrams twice daily. It's something that we typically reserve for the most seriously affected patients, and it can be quite useful, especially for hormonally driven melasma. There can be some side effects of oral tranexamic acid in that there is a risk for formation of blood clots. So for patients that have a history of blood clots, so a deep venous thrombosis, pulmonary embolism, or somebody with a strong family history of these conditions, we advise against tranexamic acid. As well, it needs to be taken in caution for patients that are smokers, people that are on the birth control pill, and also over the age of 40, because all of this slightly increases your risk of developing a blood clot. So what procedures can we perform to clear melasma? melasma. This is usually where we jump in as dermatologists to help people and advise them on what the best strategies are to help clear the pigment. So we can start with the mildest of mild, which are chemical peels. Things like glycolic acid peels can be quite safe and gentle and can help lift some of the very superficial pigment from the skin. When done carefully, the good thing about these chemical peels is they're easy, there's very little downtime, but the limitations is that really it's only going to help with the very superficial pigment, and sometimes the deeper pigments are quite resistant to this line of therapy. One of our favorite treatments is doing microneedling with the topical application of tranexamic acid. Tranexamic acid is very effective at clearing and reducing pigmentation in patients with melasma. And when we use microneedling, it helps that medication get into the deeper layers of the skin. So it will help not only with the pigments on the surface and the epidermis and the surface dermis, but it can go down deeper into the deeper layers of the dermis. It is a very safe treatment. It's safe for all skin types, including darker skin tones. There's very minimal downtime. So typically 2 or 3 days where your skin might have a bit of a rough sandpaper type texture, but most people can work. They don't need to take days off. They can take care of their children at home and all the other things that they really need to do with their life. So tranexamic acid applied with microneedling as a way to deliver the drug deeper is a very effective treatment option. And then other procedures to help lift the pigment include laser treatments to help reduce the pigment. Laser treatments must be done with caution with melasma. So there are treatments like IPL that are very common and in some cases can help. So if the pigment is very superficially placed, IPL can be a very nice, easy way to lift it. But it can actually darken deeper melasma, and particularly in patients with darker skin tones must really be done with caution. In general, we advise against it because there is, let's say, a 50-50 chance that if you're treating with IPL or BBL, that the pigment can actually get darker. One of our favorite laser treatments to treat melasma is with a fractionated non-ablative laser called the Moxi. Moxi works by taking out small little zones in the skin, very focused areas of damage, and this allows the skin to renew itself, and as it does so, it helps lift and clear the pigment. It's really safe for all skin types, and we find that patients do well, they get the rapid improvement that they're looking for, and we can feel comfortable that the risks of making the pigment worse are actually very minimal with this modality. So combining treatments with melasma is usually a must for most patients. So rarely do we see one size fits all, one treatment, that's it, and a person is good. Usually we're treating everything in combination. So we're using topical therapies, prescription and non-prescription. We are doing things like microneedling and or chemical peels, and usually we're adding lasers in there as well. Melasma pigments are very stubborn and they often can come back again. So usually what we're doing is it's a combined approach that we do over time. So again, thinking A, let's not make the pigment worse. B, how are we going to get rid of that pigment that's existing? And then part C is how do we prevent that pigment from coming back again? So it really is an individualized approach that we do according to the individual skin needs. I hope that helps bring some clarity onto this very confusing and difficult subject of melasma. I'm Dr. Elena Poulos from Kingsway Dermatology. If you have any questions, please leave them below. We love hearing from you. Thanks so much for watching. Bye for now.